Okay, so we've done an initial assessment on this patient. So now what does ongoing assessment through their stay look like? In early labor, vital signs, fetal heart rate, uterine activity, whether they have any bloody show or any vaginal discharge, all might be checked every 30 to 60 minutes. And we also want to notice at those times, how is the patient responding to what's going on? Vaginal exams are going to be done as needed only in this phase, because the more often we do an exam, the greater the infection risk. We're going to check a temperature every 4 hours until the waters are broken, and then every 2 hours. And then that continues until delivery. Okay. In active labor, we're going to bump that up, and we're going to check those things every 15 to 30 minutes. Vital signs, fetal heart rate, uterine activity, vaginal show. We're going to check those every 15 to 30 minutes. Vaginal exams still only as needed. We might see more indications to do that during this time period. We're also going to check that their bladder is emptying at least every couple hours. So I'm going to assess their bladder every hour, and every couple hours I want them to empty their bladder if possible. We want to keep an eye on the mother. How are they coping with labor? Every 5 to 15 minutes, especially when we get closer to the end of this time period. Some signs of complete dilation. So they're in this stage 1 active labor. How do we know they're getting ready to move to stage 2? How do we know they're completely dilated? They may have an urge to push or an urge to have a BM. They may have a sudden sweat line that appears on the upper lip. They may have vomiting, increased bloody show, shaking, involuntary pushing, or increased restlessness. So sometimes if they don't have an epidural, they can tell you, hey, I feel like I've got to push, or something feels different. If they have an epidural, we might still see some of those other physical changes. In the second stage, this is during pushing, we're checking vital signs, fetal heart rate, vaginal show, and how the mom is tolerating things every 5 to 15 minutes. We're monitoring every contraction. And we're looking for signs of imminent birth. So what does it look like when they're about to deliver? The baby moves down very quickly. We may see the perineum bulge. We may see the labia start to separate. Typically, if it's a first baby, we call the provider when they're crowning, which is when the head is visible and doesn't retract. And if they've had a baby already, we're going to call the provider pretty much as soon as they're completely dilated. So because they tend to have a shorter pushing stage. In the third stage, that is delivery of the placenta, we're going to be assessing vital signs every 5 minutes. We're going to be assessing for signs of placental separation. And remember, that looks like a gush of blood, and the cord gets longer on the outside. We're going to be assessing, once the placenta is separated, we want to make sure that that fundus stays really firm, and we're assessing how much blood they're losing. In the fourth stage, that's the initial 1 to 2 hour recovery period. We're assessing vital signs. Fundus is how firm their fundus is, how firm the uterus is, and lochia. Lochia is the discharge after delivery. We're assessing those things every 15 minutes for the first hour. And then from there, it can vary from one facility to another. It may be every 30 minutes times 2, or every hour times 2, but the first hour is every 15 minutes. We do a temperature at the beginning and at 1 hour. We're assessing for their recovery from anesthesia or analgesia. Are they still sedated? If they had an epidural, are they able to move their legs, lift their bottom off the bed? We're assessing perineal lacerations or episiotomy repair. Does that tissue look, are they having any bleeding from that repair? And we're assessing their bladder. The bladder is going to fill rapidly in this time period, and a full bladder will interfere with uterine contraction and lead to bleeding. So we want to assess their bladder, and probably within an hour after birth, we would like them to empty their bladder most of the time. The next section is going to be about nursing care in the first stage of labor.